breaking news. We interrupt this YouTube channel to bring you a breaking news. The Mountain Iron once more is right. Hey YouTubers, how you doing? So today I just came back from from working, and I was able to read an article while I was at work, and great news. Once more, I was right. And basically it is the Wilderness Medical Society practice guideline for basic wound management in the austere environment. Yes, I know some of my followers will be very pleased. We're back with wound care. There's not many. The reason, and the article will be down there, as well as another link for another one that actually was, I think, in another journal or near that journal, on the utility of honey, which I already talked in present, but they did a very good article on how to present and stuff. The great news with those basic wound management is that basically yours truly was basically doing what they were doing. So finally, so basically when you do those things, and I think I mentioned in the past, I think it was for the spinal, I think I mentioned it. But basically what they do is they get a bunch of expert, and when we talk expert, it's doctors that they were all doctors, I think, on that panel, that goes through disasters. So they've been to Haiti, Africa, everywhere. Basically, they do that for a living as well. Beside their job as an emergency doctor, most of them, they also be in disaster and been in the field for quite a while. And basically, they sat down on a topic, which is this one, is how would you basic wound management. And then what they do is that they gather all the literature, so all the resource that they can have to answer questions on the topic. And in this one, they did a very good job, and most of it, like I said, I'm pretty much things that already heard on this channel, but been kind of bashed by some other channels, or as well as been controversial, especially in one that I'm very happy now that's been in black and white. I'll read it, I think, once or twice. just for satisfaction. But yeah, so basically it is the guideline. So let's go through it very quickly. So basically for hemostasis, they talk about the use of tourniquet and direct pressure. Actually, they explain the reason of how much pressure it takes and stuff. So it's very well done. On the pressure point, which we talked in the past, but pressure point had previously been recommended by when direct pressure was ineffective in controlling, but some studies now have shown that there's no utility in controlling the bleeding. So the recommendation is pressure point have no role in hemorrhage control, and attempt at implementation may delay the use of more effective methods. So like we talked before, that really it's direct pressure. If that doesn't work, a tourniquet, and if that doesn't work, a hemostatic agent, or if you want to use a hemostatic agent once over there. And there's some place, like if you have a neck injury, it's very hard to do a direct pressure, or like, you know, a tourniquet on the neck. It's a no-no, by the way. But hemostatic agent would be probably the first go to, because even if you can do direct pressure, you really want it, especially if you cut like something that is bleeding a lot. Especially with the one thing they recommend here in the outdoors, because obviously it's oriented towards the wilderness, but they call it austere environment now, so it kind of encompasses disasters and stuff like that as well. One thing that they talk about is that because even with direct pressure, people will still bleed for a little bit before they stop. So they talk even here in place, like if you're in the remote, or you have 5 days by camel from the nearest hospital where you would be able to get some blood, to have a to put the tourniquet right away is maybe a very better chance, because you basically stop. So you stop the pouring, and so you can keep up a little bit more blood, versus just by direct pressure you'll still lose a little bit, because by the time it soaks the whatever you're going to use to block it and the clot to form, you're still losing a little blood. So that's one of the recommendations they talk about tourniquet, and they give and they talk about the homostatic stuff. So wound preparation and cleaning. Oh, now that's where it started to be very fun. So they describe here what they call like what's dirty, what's not dirty, and they give actually a definition which is pretty cool. And they talk about um, different substance. So for example, glass is not an organic, and actually was cool. I didn't really knew that glass is a non-organic substance, but it doesn't have a strong ions, electric charge, so basically it won't affect the impairment. But things like clay or soil with high clay content that hold ionic charge interfere markedly with leukocyte function and may decrease the amount of bacteria required for wound infection by a factor of 1,000. That was very interesting. So that basically what they're saying here is that some products, so what we were talking in the past videos of colonization versus when you pass this threshold, that basically it's an infection. So everything is dirty. Like this thing has bacteria on it. This thing has bacteria. Everything has bacteria on it. But what does in on your skin is the same thing. So what makes it that it becomes an infection is the critical point of colonization. And so they're talking here that basically some substance that you're going to have on your wounds can be worse than others. So if I have glass, so let's say I punch myself in through the window and there's a piece of glass in there, it's not as sore like if I'm in the middle of the jungle and I cut myself on the vine or something and then I get dirt in there. So it's that's what they were talking about. So they were about recommendations of different things. A septic technique. Yep, you read it right, and you read it on my channel, and I said it before this thing came out. There is no evidence that sterile rather than clean technique decrease the incidence of wound infection after management of laceration. Let me repeat that again. There is no evidence, so after all the review with the big expert, that sterile rather than clean technique decrease the incidence of wound infection after management of laceration. So basically what they're saying is that when you irrigate, you don't need sterile water. When you, or sterile saline I should say, you don't need the dressing, because in the past I had video showing if you want to carry gauze, and when I used to carry gauze, so I switched down, we'll talk a little bit later in this thing. I used to take them off and vacuum them, and people were like, how can you put down the wound and stuff? Well, they just said it here. It's that it doesn't need to be clean. It's just an aseptic technique. So basically, it just have to be a clean technique. So obviously, if you spit in the gauze and then wipe it up, not a good thing. But if you use it from the package, like I was recommending, or if you just put something that is clean, it doesn't change the thing. So they have and this actually, they have different grades. You'll see if you read the articles, what they call 1A. So this one is a very high recommendation. So basically, they're very sure what they're saying on that. They talk about a little bit of irrigation, what they talk about, the different style and stuff, and when to use a different one. I'll skip that. Debridement, they talk a little bit about hair laceration. Here they talk about the primary versus delay wound closure. We discussed about that in the past. But one thing that is very interesting for here that I really like when they were talking about, and that was I've been talking in the past, is that let me find it so I can write it exactly. So basically, what they're saying, staples and suture yield equivalent rate of wound healing, surgical site infection, and dehiscence. So basically, when it opens. Although one study showed that orthopedic surgery, so like if you repair bones or stuff, it was a little bit of different things. But I don't think we'll do much surgery here. And so basically, in the past, I mentioned that. And they actually mention here too, wound stapling devices are easier to use than suture, but are bulkier to carry and result in inferior cosmetic results. I don't agree with what they're saying as bulkier, because now there's like those little ones that have, and if we have to have the suture stuff that you need, so that means like obviously if they talk just about the suture, but usually with the suture you need something to suture with, you need like something to clean, so it's a little bit bulkier on that side. Personally, that's my own opinion on that one. But basically, the stapling device, they're very small and they can be used very easily. And so basically, what they're saying here is exactly the same thing. But for someone that is not well trained and that doesn't do, don't forget, those are doctors, and so when they do it all the time, and if you're a doctor, then you don't really need what I'm saying. But suture is not the best way, because unless you do it very frequently, it's hard. I know how to suture, but I don't use it. I use the staple. It doesn't leave a clean mark, but if you would be the position that you need that, I don't think you really care so much about cosmetic. But plus, if you would do a suture and you're not used to do it, it would be cosmetic as well. Like